Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss the relationship between COVID and male sexual health. As if COVID hasn't caused enough problems already, we are now learning that it can also creep into our bedrooms as well. Anybody on social media can tell you that there are all sorts of claims about the impact of COVID on the sex lives of men. And just in case you weren't confused and worried enough, those claims are often conflicting. While some claim that COVID can cause problems ranging from erectile dysfunction to infertility, others claim that it's actually the COVID vaccines rather than COVID itself that's causing the problems. So who do we believe? What do we know to be true versus what we think is true versus what may not be true versus what we know to be just pure nonsense? To help us sort the facts from the fiction, we're fortunate to be joined by Dr. Rina Malik. Dr. Malik is assistant professor of surgery in the Division of Urology at the University of Maryland. She completed her training at the University of Chicago and the University of Texas at Southwestern Medical Center. She is currently a member of the American Urological Association and the Society of Women in Urology. She has published over 20 peer-reviewed articles and book chapters, and also has a very popular YouTube channel dedicated to men's health that currently educates and entertains over 700,000 subscribers. And now, without further ado, I bring you our conversation with Dr. Rina Malik about the relationship between COVID and male sexual health. Hello and welcome to Better Man Clinics. Today we're going to be talking about the impact of COVID on the sex lives of men. Now, if COVID didn't cause enough problems, now we're learning that it's creeping into our bedrooms as well and affecting our sex lives, but not in the way you might think. It's not so much that guys are more and more afraid to have sex because they're afraid that they might catch COVID. It's more of concerns that COVID might actually affect their ability to even have sex, whether that means problems with erectile dysfunction, possibilities of problems with fertility, or if you believe Nicki Minaj's cousin, really, really large balls. So to make things worse, there's a lot of conflicting information out there. On one hand, you have sources that state that it's the COVID virus itself that's causing all these problems. And on the flip side of that, you have groups that are saying that the vaccines that are actually being used to prevent COVID are the culprits in this sexual dysfunction and sexual issues. So who do you believe? What's true? What's not true? And frankly, what do we really know? Fortunately, today, we are joined by Dr. Rina Malik, an expert in male sexual function, who will help us sift through what we know to be true, what we think to be true, what we think not to be true, and what we know for a fact is just a bunch of nonsense. Dr. Malik, welcome to the program.
Thanks so much for having me.
No, we really appreciate it. This is obviously a very timely topic, and guys are discussing this all of the time because, you know, their sex lives are at risk, and that is obviously important. Before we dive into the details of COVID and sexuality, actually, I want to ask a little bit about you. You know, a lot of people already know you. You are a social media sensation, which is pretty rare for a doctor. And, you know, you really focus your YouTube channel, at least from my perspective, on helping to dispel a lot of myths about male sexual function, male sexuality, everything from penis size to the time to ejaculation, all the things that guys always want to ask but are afraid to. What inspired you to do that?
Yeah, well, I started the channel primarily because my research interest was in health literacy and like helping people really understand the things we tell them. And then I realized that doing this research would take many, many years before I had a final product that I could say this is evidence-based to help educate people. And I saw, some doctors on YouTube doing this work. And I said, you know what, let me just try and see if I can make a difference, if I can reach people through social media to educate them on the questions that they have. And to be honest, when I started, I didn't expect to be debunking, male sexual health myths, but I went on there to try to educate about urology in general. And then it came to, this is the questions that people wanted answers to. And so I started really delving deep into the literature and talking to other colleagues and learning more and more myself so that I could give people educated, evidence-based education that they wouldn't get anywhere else. And it's been really an amazing journey. I found even in the United States, but outside of the United States, sexual education is really poor. And so being able to offer that education to people has been really rewarding.
No, that's so awesome and so true. I mean, it's again one of the inspirations why I'm doing this as well, is that guys have a ton of questions, especially guys, and they feel so embarrassed to ask them. So you're doing some great work in terms of really being able to get to the guys to be able to answer them.
Well,
Now,
as are you.
yeah,
As are you.
right, for
Yeah.
sure. So diving into COVID, which again is the topic du jour for a lot of people, fortunately and unfortunately. My main question is this, the first question I should say is, COVID is a respiratory virus. It's like the flu. And I can understand if we were talking about HIV or another sexually transmitted disease where we would say, okay, male sexual health is involved. Why do you think there's such a connection between a respiratory virus like COVID and all of these sexual issues?
Well, actually, there's a really great reason. So there's one thing is there's these receptors that COVID uses to attach into the body. And there's two major receptors. There's the ACE2 receptor and the TMPRSS2, which helps it kind of get in connected to the ACE2 receptor and helps facilitate its entry into the body cells. And interestingly, both of these receptors are found in really high volumes in the testes, the seminal vesicles, and parts of the prostate. So because of that impacting, these specific receptors, we've actually found COVID in testicles and penile tissue, even long after people have had COVID infections. And so this is not actually new. So mumps is a similar disease that, many that has now been, eradicated to mostly, which also affected the testicles. And so we'll see people who had mumps many years ago who then developed infertility later down the line. So that's simply why it's actually affecting men sexually. And then there's other things in the sense that it causes what's called a cytokine storm. And what that is your body starts releasing a bunch of these messengers to say, hey, you're trying to react to having this really bad infection. And that can cause your blood vessels to not function quite as well as they used to, or what we call, getting micro thrombosis or tiny little clots in the blood vessels. And, the penis is a very vascular organ. So when there's a loss of blood flow to the penis, you can get sexual side effects like erectile dysfunction. And then lastly, there's of course a lot of depression and, stress from having something like COVID, which also affects our sexual health quite a bit.
No, that actually makes a lot of sense. So let's unpack that a little bit. Let's start with erectile dysfunction. Can we safely say that COVID can cause erectile dysfunction?
Well, we can say that we know that it's correlated with an increase in erectile dysfunction because of those reasons, right? Because of the decreased blood flow to the penis. We're finding actually that even there was a study that they looked at men who had COVID 9 months ago or longer, and they actually had such bad, severe erectile dysfunction that they had to get penile implants placed. And during those penile implants, they sent tissue from the penis to the pathology lab as part of a study, and they saw COVID particles still in the penis. So I think it's very likely that COVID is causing erectile dysfunction, but is the data strong enough to say causing yet? yet. I don't know, but it's definitely strongly correlated and certainly puts you at a higher risk, about 6 times more likely to get erectile dysfunction than someone who doesn't get COVID.
Well, that's pretty convincing. 6 times more risk. Now, I know it's hard to speculate on etiology, but you had said that two things. One, you said that cytokine storm is causing blood vessels to narrow, and we know that an erection in a man occurs because there's blood rushing into the penis. So that makes sense. What about just when you were talking about the presence of these COVID particles? Are they in the penis, like on the pathology? Are they bringing in that cytokine storm into the penis? Is that what the presence of those COVID particles in the penis causing that? Do you think?
Yeah, I don't know. To be quite honest, I think that what's happening is they're using those receptors that are highly prevalent in the GU system around the penis or in the testicles, and then they're sticking around. And that's why we're seeing these long haul COVID symptoms, right? Because these particles, even though your body has now dealt with the big cytokine storm and all the symptoms that are associated with COVID early on, that they're probably still sticking around. And, we're still learning every day more and more about COVID. And so I think that these particles are just still there, and they may be causing these symptoms and kind of in a lower grade or less severe fashion, but they're still ongoing.
So potentially erectile dysfunction can be a version of long COVID.
But yes, absolutely.
So has there been any data to show whether any of those effects on the penis are reversible, like any erectile dysfunction? I don't mean reversible by treating but with Viagra. I mean like actually just go away.
Yeah, we don't know yet. I think it's too early to tell. We certainly know that people are, getting erectile dysfunction after COVID. It's not everybody, right? So people who are listening might say, well, I'm fine and I had COVID and it's not affecting me. So I think that doesn't mean that it's not happening to other people. And it certainly is. So yes, I think it's too early to tell if it's reversible. We don't have, as we don't have great treatments yet that can increase blood flow and nerve function to the penis. Certainly there are things investigational that are ongoing, but nothing that we know of that we can offer that will help reverse that. And will a tincture of time help? Well, time will only tell for now.
Do we have any indication as to whether the standard treatments for erectile dysfunction, Viagra, Levitra, Cialis, injections, pumps, etc., can help men with erectile dysfunction, presumably from COVID, or versus that they, like you said, they may just need to go to an implant? Has there been any data to help delineate that at all?
Yeah, not to my knowledge. I don't think there's been any data on that, but it's a so when you think about erectile dysfunction, there's multiple causes and it's a vascular phenomenon mostly in this case, right?
Mm-hmm.
So anything that would work for vascular erectile dysfunction should presumably be able to offer some support in patients who are suffering from erectile dysfunction. So any of those options for erectile dysfunction should hopefully help, because fortunately, people with vascular ED tend to respond better in some of these cases. But it's again, erectile dysfunction is so multifactorial, right? There's multiple insults that can happen in one person. There can be hormonal, there can be neurologic, and there can be psychological issues. As I mentioned, COVID causes a lot of stress, anxiety, PTSD. And so as that gets better, well, maybe your erections will get better. It's just very complex, as multifactorial, multiple problems. So yes, hopefully these things will work on some people and some people maybe not.
Right. Now, moving from the penis to the testicles, you said that again, also that studies have found that these COVID particles have been found in the testicles. Obviously a sore subject for men, no pun intended. What are the possible consequences of that presence of those particles in the testicles?
Yeah. So, I think the thing that we worry about is that going to affect testosterone and fertility? And so what we found in some cases with the COVID vaccination, and it's kind of, a bit complicated, but it is possible that it's affecting the production of testosterone, as well as which can in turn affect fertility, because if you have reduced testosterone production, you can subsequently have impaired sperm production and affecting fertility. And so I think that's, there's data to suggest that the low testosterone is certainly something that we've seen, especially even early on in COVID. There was Italian studies and European studies showing that. So we know that that does happen. We don't know, again, if it rebounds, likely it will, but in what time period, we don't know. And will that affect fertility? So we know that fertility can be affected by having high temperatures, high fevers, and, you know, those sorts of things. So that's the concern, is like, will it affect fertility in the long term? In the short term, certainly it will. I mean, that will be, any sort of infection would affect fertility, but in the long term, we don't really know.
And I would assume that testosterone, the impact on testosterone can affect sexual function as well, even aside from fertility, particularly for maybe even older or even younger men, right? Because of the hormone decreasing.
Absolutely. I mean, testosterone, as you know, is so important for so many things. It does play a role in erections, but also libido, your cognitive, how clear your brain feels, your bone health, your ability to get muscles and gain muscle when you're in the gym. So there's so many benefits to testosterone that you are going to suffer, which may contribute to why people feel so much fatigue and confusion after having COVID. Those people who we talk about with the long haul syndromes, that may be something that contributes to it.
And that's an interesting thought, right? Because those are pretty, that brain fog and fatigue and whatnot are pretty classic symptoms of low testosterone. It very well may be a factor in men. How does that, obviously that might translate into, low sperm count stuff. Have they looked into parameters like, semen samples in men to see if it affects any sperm count or any impact that way?
I don't know off the top of my head on the COVID. Like the last time I checked, there wasn't great data on this yet. I'm sure that they have published it, but there's so much data that's coming out with COVID lately. But I've certainly seen, data on the vaccination, and we can delve into that shortly. But, I think that really what we need to know is going to take some time, because I think that, yes, even if it's 6 months later or a year later, we really need to see that time difference to see if fertility is going to be affected in the long term or the short term. And that certainly has implications if your partner is a little bit older and you're trying to get pregnant in a shorter window. Getting COVID can really derail that in the short term. We know that. Sorry about that.
No problem.
And so we know that COVID can really derail that in the short term. And so certainly if you're trying to conceive, stay safe, wear, social distance, wear masks, get vaccinated, because, even a few months can make it harder to conceive if you're already having trouble.
Now, this might be a strange question, difficult to answer. Like, so if men had COVID, or maybe they don't know if they have COVID and they're thinking about having a baby, do you think it makes sense for them to get a semen sample just to make sure, or check their testosterone levels? Or do you think that's a little bit of overkill at this point?
I think that certainly if you're like a little, not you personally, but if your partner is a female and you're trying to conceive and she's a little bit on the older side, certainly you want to stack everything in your favor. So in that case, I would, there'd be very little harm in doing so. I also think that if you've been trying for, 6 months, usually we say to wait 12 months, but if you've been trying for 3 to 6 months and you're worried about COVID exposures, it certainly doesn't hurt to get it taken, get it evaluated. But, realizing that if you had COVID, this could be reversed over time. And so maybe getting that analysis will actually just freak you out and
Right.
cause more anxiety than good. So, I think there may be pluses, but you have to think about what kind of person you are. If it's going to give you a lot of anxiety, then probably just don't do it unless you really meet the criteria for infertility.
Got it. So, to sum up on the COVID side, what do we know for sure? We know that at the very least, there is a relationship between COVID and erectile dysfunction. Like you said, the statistic you threw out, 6 times higher chance of erectile dysfunction post-COVID. And we know that there seems to be some impact of COVID on fertility, again, with hormonal levels and potentially even semen parameters. Of course, the jury's out long term. Now, on the flip side of this discussion are the COVID vaccines. And I found it interesting that, at least to my knowledge, before we saw the barrage of COVID and sexual function on social media and online, the first questions came up about the vaccine. There was a lot of guys were and ladies actually were reluctant to get the vaccine because of a lot of concerns about fertility. That was like the big one that kept coming up over and over again. And more recently, there was concerns about erectile dysfunction, and of course, we can't forget Nicki Minaj's cousin, which was truly entertaining. I guess my first question is similar to COVID itself, why this vaccine? There's been no other vaccine where people were losing their minds about fertility or sexual function. Why this vaccine? Why are people so freaked out about it?
Well, I think people are freaked out because it's an mRNA vaccine. And what that means is that the vaccine uses mRNA, which is a part of like genetic code that's made in a lab, that then goes in, that's injected into your body. And then your body, this mRNA tells your body to start making the spike protein of COVID, which is, essentially the way COVID attaches to the cell. It uses this thing called the spike protein. And so your body then recognizes the spike protein and starts making, your own immune response to it. But because it's this new type of vaccine that we haven't used before, it's using DNA, that people started really getting scared of how this is going to impact growing cells, right? Are they going to take into this? Are they going to take up this mRNA? How is that going to impact the growing fetus? And so that's, I think why people got really concerned about it.
Mm-hmm. And to your knowledge, I mean, with these mRNA vaccines, again, these mRNA goes in and creates a protein, but at least the purpose of these vaccines are not to integrate into your host DNA, into the person's DNA and start making changes, correct?
Exactly. It's not going to become part of your genetic makeup. And I think that's where people just got concerned. They heard this thing, mRNA, they realized it was made out of, DNA, and people are, a part of our genetic makeup, and they got really concerned. And I think that there is obviously a lot of vaccine hesitancy in general in our population. And there's been a lot of polarity with COVID, which is unfortunate that it's become such a emotionally charged thing, and a lot of fear and hesitation. And people are really getting a lot of misinformation, which I think is really the key here, is that there's so much rampant medical misinformation from sources like Nicki Minaj, who people think are, who people really believe and people really follow, and think these people are geniuses and know everything because they're very famous, right? But I think that ultimately that's really the biggest issue, is this misinformation.
Yeah, I mean, it just seems like there's a lot of distrust out there. And so like when people lose trust, they kind of start looking around, and they start going to celebrities and whatnot because they haven't steered me wrong before, make great music, etc. But it is troubling, right? Because people are making life decisions based on a story about Nicki Minaj's cousin potentially. What do we know in terms of, if anything, in terms of the relationship between the vaccines and fertility in men, for instance?
Well, in fact, there's been quite a few studies, well, two big ones that have looked at the Moderna and Pfizer, oh my gosh, I'm sorry, the Moderna and Pfizer vaccine, that have shown no impact of the vaccination on semen parameters. So they've looked at things like the volume of sperm, the concentration and number, and the ability of the sperm to move, and they've seen no difference in people before the vaccine and then after a certain period of time. One of them was like 75 days, another one was a little bit different, but they took a good amount of distance from getting the vaccine and saw no difference in sperm parameters. And so not just one study, but a few. And so I think that really there's been no evidence at all that getting the vaccine is going to affect your ability to conceive based on your semen parameters, which is the best way to assess a man's fertility.
Have they, going back to the same scenario with the COVID, have they seen any changes in testosterone levels?
Yeah, I don't believe so. So I think that these studies, again, I don't know the data off the top of my head on the testosterone, but I don't believe that COVID-19 has shown any impact, at least the vaccine has shown any impact on testosterone. And I do a lot of low testosterone in my clinic, and I will say that I'm not seeing people who've gotten vaccinated to have any different levels than than those who didn't get vaccinated, or who, basically from the general population.
Got it. And so I guess a question, and this is going to be hard to answer, and I'm just going to throw it out there though. A question is, these vaccines create the spike protein, which is kind of one of the key parts of the virus, right? And we talked about how the native virus, the actual COVID virus, goes throughout your body and it can implant in the penis, it can implant in the testicles. The question that guys might have is, so why wouldn't this spike protein or whatnot do the same thing and cause the same problems?
Yeah, well, so it's the way that it's developed. Essentially, the vaccine is your body sees this spike protein, but it doesn't have the COVID particle attached to it, right? So it's not going to cause any harm. The harm comes from the actual COVID particles, right? The actual virus itself, which is not associated with the vaccine. And that's kind of how vaccines work. You're either getting, the traditional vaccines, you're getting, a dead or inactive vaccine or virus, whereas in this case, you're getting the mRNA because you're exposed to the actual virus itself.
Got it. So even if in this situation, even if that spike protein were to circulate all over the place, it can't actually cause the harm. It's not going to cause those cytokine storms. It's not going to implant in your body and cause that, basically.
Exactly.
Because I think that the concern that guys have is that, some people who get the vaccine, right, they might get a fever for a day or so, and they may feel like they have a mini version of COVID. And the concern is, well, are my testicles and my penis going to get that mini version of COVID as well? But it sounds like that's not the case. At least
that's just your immune system. Yeah, that's just your immune system reacting to like getting any sort of foreign, response to something foreign. People get fevers and chills with the flu vaccine, right? So I don't think it's any different, but understandable why people would be concerned about that. But certainly you're not getting exposed to COVID through the vaccine. So you're getting exposed to the spike protein, which is going to help prevent COVID when you do get exposed to COVID, if you get exposed to COVID, from not being able to enter your body.
Got it. And so you talked a lot about semen parameters, which is really helpful in terms of that's reassuring. But guys are going to ask, well, have they actually seen like compared men with and without the vaccine in terms of their ability to actually conceive? Because, semen parameters and everything. Now, I know it's a hard question to answer because time and whatnot, but I had to throw it out there. I know they're going to ask.
Yeah, no, not yet. Again, not yet. But one would assume, right, that if you have good semen parameters, and the interesting part about this is they looked at men also who were oligospermic, meaning that they had lower volumes of sperm concentration or sperm concentration, and those men were also not affected. So even though they were oligospermic to begin with, they still had the same number of sperm. They didn't get reduced. They weren't impacted. So they looked at it even in that sub cohort. So, time to conception is going to be very difficult, and going to take a much larger group of people to identify. And, it's going to take more time before we know that. But really the best surrogate is if your sperm are functioning well, and functioning normally, then you should be able to. There are other factors, right, associated with conception, your partner and those issues as well. So it shouldn't affect the things that matter, which is how well you can produce sperm. It's not going to change how well you can expel sperm, and it's not going to change your partner's factors, which all play a role in fertility.
And this is going to be, and I apologize ahead of time, it's going to seem like a weird question, and you kind of already answered before, but what about birth defects, right? Like there's okay, fine, my semen looks fine and whatnot, but now you have this mRNA floating around and maybe it gets into my sperm and then I can conceive, but I'm going to pass on some type of birth defect. I'm going to have babies with spike proteins or something coming out, something along those lines, not to make little of it, but is that a valid concern? Have they looked into it? Any thoughts about that?
Yeah, there's been no concerns. I mean, through all the studies and all the data we know, and all the societies, whether it's women or men, there's been no concerns of getting the vaccine when you're trying to conceive, when you're pregnant for your partner. There should be no concerns. People are getting the vaccine during lactation for partners who are lactating. So I think that there's no concerns from our end on any issue of passing it on to your child or in any form, breast milk during when they're gestating, when they're growing, anything like that.
Got it. And let's switch gears from infertility. Now let's talk about, again, going back to erectile dysfunction. Relationship there, any concerns? I mean, there's a strong relationship, 6-1 for COVID itself, but the vaccine?
Yeah, no data to suggest that the vaccination is affecting erectile function at all. So really, again, these are really rigorously monitored with the vaccine. I mean, the trials are very rigorous. They collect every single adverse event, even if it's not related to the vaccine. Like if you had a scratch on your knee, they're going to put that in the report. So they're really, really rigorous about collecting that data. And there hasn't been any any report of erectile dysfunction associated with people who've gotten the vaccination.
And I mean, from a theoretical perspective, that makes sense, right? Because the very causes of erectile dysfunction that you outlined, meaning these particles being implanted in the penis, as well as a cytokine storm, neither one would really occur to any appreciable extent with the vaccine, correct?
Correct.
Because to my knowledge, I mean, you had mentioned, one thing that guys might bring up, and I want to kind of front end that here as well, is that you had mentioned that, the vaccine obviously can cause an immune response. And isn't that the same thing as a cytokine storm? Won't that immune response cause this damage to blood vessels?
Yeah, well, I mean, so it's a much tempered immune response, right? The cytokine storm with COVID-19 is immense. It's like, 10x, 20x compared to what you're getting, like a 0.1x of a cytokine storm that lasts for like a couple hours, maybe, So it's really short-lived, and it's really your body just creating this immune response in a shortened window. So it's really much, the implications of long-term effects are going to happen when you have COVID, which lasts for several days, 10, 14 days, and causes damage over a long period of time.
Got it. And so now we turn to really the most compelling part of the podcast, because everybody needs to know what the heck is going on with Nicki Minaj's cousin. Can you shed some light on this, please?
Well, I mean, so, from what I recall, again, it's been a while since I saw the tweet, but she basically commented that her brother became infertile. His balls got really big, and it was all after the COVID vaccine. And to be quite honest, it sounds more like her cousin had a sexually transmitted infection, which would cause all of those things to happen, and blamed it on the vaccine so his partner wouldn't get angry. And so it was an easy scapegoat for this person to blame it on, something else that would obviously get a lot of, would potentially be believable, because people don't really, because of all this misinformation, people will believe anything if they're in the right mind space. And so, clearly he tried to get out of that, and probably she found out, and that's really why she left him, and not necessarily the COVID vaccine.
I think that's a pretty good explanation there. It makes a little bit of detective work and a lot of information, but that's why we have the experts on the show. So, I want to wrap up here just by talking about this initiative that you're part of, which I think it's what's called Save Your Future Boners, which is aptly named. So if you can share a little bit about what that is and kind of why you got involved, I think it's an important project.
Yeah, so it's kind of like a PSA for men, young men, all men actually, trying to convince people to get the COVID vaccination, because, really this concern of having 6 times more likelihood of getting erectile dysfunction. I mean, we want men to have, as urologists, we all want men to have vibrant, healthy sex lives. And if nothing else can convince you, well, your erections should be able to convince you, like being able to protect your erections for the course of your lifetime. I mean, we hope that that's enough to push people to get vaccinated. And so that's where this was born. The group that started it is a video production company out of Chicago, and they came up with the idea, approached a bunch of urologists, and really they were the brains behind it. They did such an amazing job, and they did all the work of getting the team together, making the video. And I just think it was great. It was funny. It was well thought out, and we've had a great response to it. So I think ultimately it was well worth the effort, and really I was just honored to be a part of it.
That's fantastic. I think that will hopefully help a lot, because I mean, what we've learned here, just to sum up today, is that on one hand, we have evidence to show that there is a higher likelihood of erectile dysfunction after COVID. We have evidence that at the very least, COVID can impact the hormonal milieu, if you will, and which can affect fertility. And what we also have is the benefit of a lot of data on the side of the vaccinated, right? Because as you mentioned, this was a really interesting point that I never thought of, is that, you know, millions of people have gotten COVID, but there's no way that science can track every reaction somebody had from COVID versus people who are getting the vaccines. That these companies and the government is hyper vigilant about following up about every possible side effect. So whereas the COVID data, the true COVID data might be less robust, the COVID vaccination data is extremely robust. There's a ton of it out there. And based on what I'm hearing from you is that there's nothing to support either an impact on fertility or erectile dysfunction in guys from the vaccine. Is that summing that up correctly?
Exactly, 100%. So get vaccinated, protect your future boners and your
But that sounds like a fantastic way to pause. Before we let you go, I'm going to ask you one last question. It has nothing to do with COVID whatsoever. You know, we call this program Better Man Clinics because the whole idea is to get better in many different ways and live your best life. And so every expert I have on here, by virtue of being on here, has reached a certain level of success. And in your case, it's a big level of success. What's the secret to your success? How do you live your best life?
Wow, so many secrets, but I will say that one is just being persistent. Like, you know, you're going to do stuff, whatever it is, and you're going to fail or you're not going to get the response you want. And just keep going, because that's what separates successful people from those who don't succeed, is because people give up when they, you know, they should persist and keep working at something. And I mean, there's always times to give up when you realize you're not going anywhere with what you're doing. But if you're making progress, but it's not what you want it to be, you know, keep going.
That's better words could not have been spoken, right? Perseverance and keep on grinding away till the finish line. Dr. Malik, it's been a pleasure. Thank you so much. You've provided a tremendous amount of information for us. We thank you for that. And for the guys out there listening and watching, thank you for joining. And remember our mantra here at Better Man Clinics: your best life is a journey and not a destination, and use every single day to get just a little bit better. We'll see you all next time.